Chronic kidney disease affects an estimated 37 million Americans, according to Cleveland Clinic, and approximately 90% of them do not know they have it, according to the National Kidney Foundation. For women over 60, the risk is especially high. Data from the National Health and Nutrition Examination Survey found that approximately 40% of adults over age 60 meet the technical criteria for chronic kidney disease, according to the PMC review on CKD in the elderly. A separate PMC epidemiology update confirmed that among adults aged 70 and older, the prevalence of CKD stages 1 through 5 reached 27.9%, and among those aged over 80, more than half meet CKD criteria. According to the American Journal of Kidney Diseases, the median age of new dialysis patients is now 65 years, with the fastest growing group being those over 75. The National Kidney Foundation recommends that all adults over age 60 receive kidney function testing, meaning that if you are a woman over 60 and your physician has not checked your estimated glomerular filtration rate and urine albumin in the past year, that screening is overdue. What makes chronic kidney disease so dangerous is not the damage it does once diagnosed. It is the years it spends progressing silently before any symptom appears. According to the National Kidney Foundation, developing CKD is usually a very slow process with very few symptoms at first, and many people living with it do not have any symptoms until the more advanced stages and complications develop. But kidneys are remarkably capable of compensating for early damage. They can lose more than half of their filtering capacity before the waste products in the blood rise to a level that begins producing symptoms. By the time the first noticeable sign appears, a meaningful proportion of kidney function may already be gone, which is exactly why recognizing the earliest and most subtle signs of kidney decline matters so much, and why the 13 signs in this video are not presented as dramatic emergencies, but as quiet body communications that most women over 60 attribute to aging, to other conditions, or to nothing at all. This video is for educational purposes only. All of these signs have causes other than kidney disease, and none of them individually confirm kidney failure. The only way to know whether your kidneys are in trouble is a blood test for creatinine and eGFR, alongside a urine test for albumin. Two simple, widely available, and inexpensive tests that your primary care physician can order at any routine appointment. Sign number 13. Extreme fatigue and weakness that does not improve with rest. A tiredness that is present in the morning as well as the evening, that makes ordinary daily tasks feel disproportionately effortful, and that has appeared or worsened without a clear new illness or increased physical demand. An older woman who used to walk her neighborhood every morning, now choosing to sit in her garden instead, finding that the short distance to the mailbox leaves her more tired than it should. The kidneys produce a hormone called erythropoietin, EPO, that signals the bone marrow to produce red blood cells. When kidney function declines, EPO production falls, red blood cell production falls with it, and the result is anemia, fewer oxygen-carrying cells circulating to the muscles, brain, and organs. According to Johns Hopkins Medicine, when kidneys are damaged, they make less EPO, which means fewer red blood cells are available to carry oxygen, producing the condition called anemia, which causes fatigue that can be treated once identified. According to HealthTree for kidney disease, anemia causes extreme tiredness that does not improve with rest because the underlying cause is not insufficient sleep, but insufficient oxygen delivery to every tissue in the body. This EPO-related fatigue is compounding. As kidney function declines further, the toxin buildup in the blood adds an additional layer of systemic exhaustion on top of the anemia-driven fatigue, creating a level of tiredness that most women attribute entirely to the normal progression of aging. Sign number 12. Changes in urination frequency, color, or amount, urinating more often than usual without having increased fluid intake, especially at night, producing urine that is darker, cloudier, or more foamy than normal, or noticing that urine output has decreased while feeling as though the bladder should be fuller. An older woman who has begun needing to empty her bladder more frequently throughout the day, finding that the urine looks darker or more concentrated than she remembers it normally being, attributing the change to drinking less water. According to Cleveland Clinic, in the early stages of kidney disease, the pattern of urination changes, needing to urinate more often in different amounts with different coloration as the damaged kidney filters begin allowing abnormal substances into the urine while retaining substances that should be excreted. According to Johns Hopkins Medicine, urine may be foamy or bubbly, more or less frequent, different in amount, darker or paler than usual, and may contain blood, all reflections of filtering function that is no longer operating normally. According to the Kidney Disease Symptom Report from Life Options, patients describe noticing their urine changing before any other kidney symptom was apparent, with frequency, color, and the sensation of pressure all developing before any formal diagnosis was made. Sign number 11. Foamy or bubbly urine. Urine that consistently produces a foam or bubble layer that does not dissipate quickly after contact with toilet water, similar in appearance to the foam produced when scrambling eggs. An older woman noticing for the first time that her urine looks different, that there is a persistent layer of small bubbles at the surface after she urinates that remains long after she would normally have flushed. This sign is one of the most specific early indicators of kidney filter damage. The kidneys normally keep proteins, particularly albumin, inside the bloodstream where they belong, rather than allowing them to pass through the filtration membranes into the urine. When the glomerular membranes that form the kidney's filtration barrier are damaged, albumin begins leaking through into the urine. According to the National Kidney Foundation, this foam may look like the foam produced when scrambling eggs because the protein found in urine, albumin, is the same protein found in eggs, and its presence in urine indicates that the kidney's filters have been damaged, allowing protein to leak. According to Health Tree for Kidney Disease, many people with kidney disease experience sleep problems including insomnia, sleep apnea, and restless leg syndrome, all driven by the buildup of toxins that functioning kidneys would normally clear. Sign number 10. Difficulty sleeping, restless legs, or waking frequently at night for reasons other than urination. An inability to fall asleep or stay asleep that has developed without a clear psychological cause, sometimes accompanied by an uncomfortable crawling or restless sensation in the legs that worsens when lying still. An older woman lying awake at midnight with an uncomfortable feeling in her calves and feet that makes her want to move her legs but provides no relief when she does. According to the National Kidney Foundation, when the kidneys aren't filtering properly, toxins stay in the blood rather than leaving through urine, and this can make it difficult to sleep. And the link between kidney disease and sleep apnea, which further disrupts rest, is well documented. The restless leg component is driven by the accumulation of urea and other nitrogenous waste products in the blood that affect nerve function in the lower extremities, producing the uncomfortable sensations that make stillness impossible. According to Health Tree for Kidney Disease, many people with kidney disease experience sleep problems including insomnia, sleep apnea, and restless leg syndrome, all driven by the buildup of toxins that functioning kidneys would normally clear. Sign number 9. Swelling in the legs, ankles, and feet, bilateral puffiness that is worse at the end of the day, that leaves visible sock indentations after removing stockings, and that does not resolve overnight in the way that normal positional swelling does. An older woman sitting down at the end of the afternoon and looking at her ankles, noticing that they are noticeably rounder and softer than they were that morning, and that her shoes felt tighter as the day went on. When the kidneys cannot remove excess fluid and sodium from the body as they should, that fluid distributes into the soft tissues of the dependent extremities, the areas lowest in the body during upright position, which are the ankles and feet. According to the National Kidney Foundation, decreased kidney function can lead to sodium retention, causing swelling in the feet and ankles. According to Johns Hopkins Medicine, failing kidneys don't remove extra fluid, which builds up in the body, causing swelling in the legs, ankles, feet, face, and hands. According to Life Options, patients report ankles so swollen they could not get shoes on and exhaustion from simply walking to a bus stop, describing the fluid retention as something they dismissed for months before connecting it to a kidney problem. The important clinical distinction between cardiac and renal edema, kidney-related swelling is often accompanied by other urinary symptoms, facial puffiness around the eyes, and sometimes foamy urine,
a combination that points more specifically to kidney filtration failure than to cardiac causes alone. Sign number 8. Dry, itchy skin. Particularly itching that feels as though it originates deep beneath the skin rather than at the surface, that is not relieved by scratching or moisturizer, and that may be worse on the back, arms, or legs without any rash to explain it. An older woman who has tried every lotion available and still cannot find relief from an itching that seems to come from inside her body, that is worst at night, and that her dermatologist has been unable to explain with any skin condition. When the kidneys can no longer remove waste products from the blood efficiently, certain minerals, particularly phosphorus, accumulate in the bloodstream. According to the National Kidney Foundation, dry and itchy skin can be a sign of the mineral and bone disease that often accompanies advanced kidney disease, when the kidneys are no longer able to keep the right balance of minerals and nutrients in the blood. According to the National Kidney Foundation's expanded sign overview, some people with kidney disease get itching that feels deep under the skin, especially on their back, arms, or legs. This deep quality distinguishes it from surface-level dry skin irritation and from eczema or other dermatological conditions. According to HealthTree, itching can be mild or severe, caused by waste buildup in the bloodstream, and the itching can be intense, like it is coming from deep within the body and is not relieved by scratching.
Sign number 7. Puffiness around the eyes, particularly in the mornings when swelling is most prominent before the fluid redistributes during the day's upright activity. In a woman who has not significantly changed her sodium intake, is not under new sleep stress, and has no identified allergic cause for periorbital swelling. An older woman looking at herself in the bathroom mirror after waking, noticing that the soft tissue under and around both eyes appears fuller and more puffy than usual, and assuming it is simply age-related tissue changes. According to the National Kidney Foundation, puffiness around the eyes can be due to the kidneys leaking a large amount of protein into the urine rather than keeping it in the body. The mechanism: albumin in the bloodstream exerts osmotic pressure that helps hold fluid inside the blood vessels. When albumin leaks into the urine through damaged kidney filters, the osmotic pressure in the blood drops and fluid escapes from the capillaries into surrounding tissues, particularly in the loose connective tissue around the eyes, which accommodates fluid accumulation more visibly than other areas. Morning periorbital puffiness combined with foamy urine and ankle swelling is a clinically recognized triad that points specifically to nephrotic syndrome, significant protein loss from kidney damage, and warrants same-day or next-day physician evaluation. Sign number 6. Nausea, loss of appetite, or a metallic taste in the mouth. A persistent queasiness that is not related to any specific food or meal timing. A reduced desire to eat that has developed gradually without emotional explanation. Or a taste in the mouth described as metallic, ammonia-like, or simply off even when no food has been eaten recently. An older woman pushing food around her plate at dinner, eating much less than she used to, finding that food does not taste the way it should, and that the smell of cooking sometimes makes her feel queasy, blaming it on changes in taste that come with getting older. According to Johns Hopkins Medicine, when waste builds up in the blood, a condition called uremia, it can cause a metallic taste in the mouth and ammonia-like breath as these waste products cross into the saliva and respiratory system. According to WebMD, kidney disease can cause nausea or vomiting that upsets the stomach and leaves the person with little craving for food, sometimes leading to weight loss over time. According to HealthTree, toxins trigger the part of the brain that controls vomiting when the kidneys start to fail, and waste accumulates beyond what the body's other systems can compensate for. Loss of appetite in older women is so routinely attributed to age-related changes in taste and smell, to depression, or to medication effects that its connection to progressive kidney function decline is almost never considered until other more obvious kidney signs have already appeared. Sign number 5. Needing to urinate more frequently at night, waking 2, 3, or more times from sleep to urinate when this was not previously part of the normal sleep pattern, particularly when the urine produced during these nighttime visits is pale and large in volume rather than concentrated and small,
An older woman who has begun waking at 2 a.m., then again at 4 a.m., setting her alarm earlier so that the fatigue from broken sleep does not affect the whole morning, attributing it to a small bladder, to drinking too much in the evening, or to the general difficulty of sleeping deeply as one ages. This is the sign most consistently dismissed and most consistently misattributed to everything except the kidney: prostate problems in men, bladder weakness in women, evening fluid habits, or simply aging. But the mechanism that produces kidney disease-driven nocturia is distinct from all of these, and understanding it is what makes this sign recognizable for what it is. Healthy kidneys concentrate urine efficiently throughout the day and produce less, more concentrated urine at night, allowing uninterrupted sleep. One of the earliest functional changes in chronic kidney disease is a reduction in the kidney's concentrating ability. The tubular structures that normally reabsorb water and concentrate the filtrate lose their efficiency as kidney damage progresses. The result is that the kidneys begin producing larger volumes of more dilute urine at all hours, including overnight, forcing the bladder to fill more quickly and triggering the urge to void more frequently at night. According to the National Kidney Foundation, if you feel the need to urinate more often, especially at night, this can be a sign of kidney disease. And when the kidney's filters are damaged, it can cause an increase in the urge to urinate. According to Cleveland Clinic, a need to pee more often is specifically listed among the symptoms that develop as kidney disease worsens. The quality of the nighttime urine matters. If the urine produced during these nighttime bathroom visits appears pale and copious rather than dark and concentrated as nighttime urine normally should be, this is the clearest signal that the kidney's concentrating mechanism is impaired. Every woman over 60 who has developed new-onset nocturia, waking at night to urinate more than once when this was not previously her pattern, should request a kidney function panel at her next physician appointment, rather than accepting this change as inevitable aging. Sign number 4, flank pain or discomfort, a persistent dull ache on one or both sides of the lower back, between the ribs and the hip, that is not related to any known musculoskeletal strain or injury, and that does not change significantly with movement or body position. An older woman who has been managing what she describes as a backache below her ribs on the right side for several weeks, having already tried anti-inflammatory medication without relief, not realizing that the discomfort is localized to the area directly over the kidney rather than to the spine or the muscles. The kidneys sit on either side of the spine in the retroperitoneal space, flanked by the lower ribs above and the pelvis below. Kidney disease itself does not typically produce pain through gradual functional decline. The kidneys have no pain fibers for pressure from within. But when kidney disease is accompanied by kidney stones, infections, cysts, or significant structural changes, the pain-sensitive capsule surrounding the kidney can be stretched or irritated, producing flank discomfort.
According to National Kidney Partners, pain related to kidneys is usually felt in the lower back on one side of the spine or in the flank area and is often dull and persistent rather than sharp or stabbing. Any flank pain that is persistent, that does not respond to usual back pain management, and that is accompanied by any urinary symptom warrants evaluation that includes kidney imaging and function testing. Sign number 3, shortness of breath during activities that previously did not cause breathlessness, climbing stairs, walking to a nearby destination, carrying groceries, combined with or preceded by a persistent cough that produces frothy or foamy mucus. An older woman stopping halfway up her staircase to catch her breath, noticing over the past several weeks that activities that were previously effortless have begun requiring pauses, and finding that lying flat makes the breathlessness worse at night. When kidney disease advances to the point that the body can no longer remove excess fluid efficiently, that fluid can accumulate in the lungs, a condition called pulmonary edema, which reduces the lungs' air exchange capacity and produces breathlessness. According to Cleveland Clinic, shortness of breath is listed among the symptoms of advancing CKD. According to HealthTree, shortness of breath can happen when extra fluid builds up in the lungs as kidney function declines. The anemia component of kidney disease also contributes to breathlessness by reducing the blood's oxygen-carrying capacity, meaning that even normal physical activity demands more respiratory effort to deliver adequate oxygen to working muscles. Any new onset of unexplained breathlessness in a woman over 60, particularly when accompanied by any urinary changes or ankle swelling, warrants urgent evaluation that includes kidney function assessment alongside cardiac evaluation. Sign number 2, blood in the urine. Coloration of the urine ranging from thick pink to clearly red or brownish, appearing without any known urinary tract infection, kidney stone, or other identified cause. An older woman seeing that her urine has an unmistakable pink or reddish tint and initially thinking it is an infection or something she ate, waiting several days to see if it clears on its own. According to the National Kidney Foundation, healthy kidneys typically keep blood cells inside the body when filtering waste from the blood to create urine. When the kidney's filters have been damaged, these blood cells can start to leak out into the urine. According to Johns Hopkins Medicine, you may see blood in the urine as a direct indication of kidney filter damage. Blood in the urine is not a sign to monitor at home for days. According to the National Kidney Foundation, blood in the urine can also indicate tumors, kidney stones, or infection, none of which is a benign finding, and all of which require same-day or next-day physician evaluation or emergency evaluation if the bleeding is significant. Any woman over 60 who observes blood in her urine, regardless of how faint the discoloration, should contact her physician the same day rather than waiting for the next scheduled appointment.
Sign number 1. Difficulty concentrating, mental cloudiness, or cognitive changes that have appeared or worsened over recent months. Trouble following complex conversations. Difficulty remembering recent events that would previously have been easily retained. Or a general sense that thinking feels slower and more effortful than it used to be. An older woman who has been forgetting words mid-sentence, who misses details in conversations she used to follow easily, who has been told by family members that she seems less sharp than a year ago, attributing all of it to aging-related cognitive change without knowing that kidney function tests have never been part of her cognitive evaluation. When kidney function declines, the accumulation of waste products in the bloodstream, including urea, creatinine, and numerous other uremic toxins, affects the brain directly. These toxins cross the blood-brain barrier and impair the electrochemical processes that underlie concentration, memory formation, and information processing. According to Cleveland Clinic, trouble concentrating is listed among the symptoms of worsening chronic kidney disease. According to National Kidney Partners, toxin buildup due to impaired filtration causes changes in breath, taste, and cognitive function as kidney disease advances. The PMC review on CKD in the elderly specifically documents that CKD in older adults increases the risk for cognitive impairment as a direct adverse outcome of declining kidney function, meaning that in an older woman presenting with new cognitive symptoms, kidney function should be tested as part of the evaluation before the decline is attributed entirely to neurological aging. The two tests that detect kidney disease before symptoms become severe are straightforward, inexpensive, and available at any routine medical appointment. A blood test for serum creatinine and eGFR measures how efficiently the kidneys are filtering waste from the blood. A urine test for albumin to creatinine ratio measures whether protein is leaking into the urine through damaged filters. According to the National Kidney Foundation, having an eGFR under 60 and the urine ACR over 30 for 3 months or more is a sign of kidney disease, and both tests together give a complete picture that neither test provides alone. If you are a woman over 60 and you have not had both of these tests in the past year, requesting them at your next appointment is the single most important action this video can prompt you to take. The kidney is the organ that does its damage in complete silence and then asks for urgent help when it is already significantly compromised. 13 signs, 2 tests, 1 appointment. That is the entire distance between knowing and not knowing. Watch the next video on screen right now.